Hi, I'm Suzanne Bryjack, and I'm one of the founders of the NICU Family Support Program at the Valley Hospital, and co-PI and one of the nurture specialists on the Family Nurture Care Study. The Valley Hospital is the first hospital in New Jersey and one of the first in the tri-state area to collaborate with the Nurture Science Program at Columbia University to bring this cutting-edge, evidence-based research standard of care to their families that focuses on restoring emotional connection in NICU. This video is an introduction and a little bit of an insight into what we do and how these evidence-based results can change outcomes for our babies and families, and the benefits extend to staff as well. Enjoy.
When your baby's in the NICU and all the doctors and the nurses are taking care of your baby, it's hard to feel motherly. You're not feeding them, they're getting fed through a tube. You're not breathing for them because they have their CPAP on. You're not helping them go to sleep because they're in the isolette or they're in their cribs and they're hooked up to their monitors.
I've been at Valley for 27 years. Being in the NICU is very stressful for a parent. I think because they feel they've lost control very early in the infant's hospital course. It's important that we give them control back, to let them hold their baby, do skin to skin, and to get involved in their care.
The good news is that family nurture intervention is a remedy for interrupters.
Family Nurture Intervention helps modulate stress through calming sessions, using simple nurturing interactions to level the playing field for even the sickest of babies by strengthening emotional connection and autonomic co-regulation. Autonomic co-regulation is a natural phenomenon between mother and baby. It begins in pregnancy and continues into childhood.
Normally, contact between mother and infant produces a calming reflex, a subconscious physiological calming reflex in the bodies of both the mother and the baby, unless the emotional connection between the two has been interrupted. Emotional separations are part of life. The key is to reconnect emotionally every day, no matter what.
In Family Nurture Intervention, a trained specialist helps the parent and child reconnect using techniques such as talking, eye contact, and holding.
We try to reestablish that bond. It's not didactic. It's something they have to feel. They have to experience it.
Really, one thing that we also were really excited about was seeing more mature EEG patterns in those babies at 35 weeks who were recipients of family nurture care compared to those 35-weekers who had not received family nurture care during our initial phase of baseline data. This was really profound to us because it really showed that by implementing family nurture care from day one, and even in some cases before the babies were born, with the mothers on labor and delivery or in the antepartum space, we really were able to see an improvement in these babies' overall brain activity with more mature patterns as early as 35 weeks, which was the first time that we actually looked at that. And this is remarkable, and we're really excited to really look at that and dive a little deeper into what that means. So overall, bringing family nurture care really changed the bar, raised the bar.
One of the other measures that we looked at was the Parent Stressor Scale NICU. During our standard care phase, as time went on in NICU, parents became more and more stressed over time. During our family nurture care phase, what we found was the longevity of time did not impact their stress. And in fact, the stress of parents decreased over time in NICU. Concurrently, we found that our staff had decreased emotional exhaustion on the Maslach burnout inventory and increased team development. Those were really poignant results because if you think about this decrease in parent stress and how that correlates to decreased emotional exhaustion and better team cohesion in NICU, these results extend way beyond families and babies and beyond the amazing developmental effects to really add to the entire environment in the neonatal intensive care unit.
Parents are encouraged to hold their babies as soon as the babies are medically stable, which has improved the bonding. Parents feel involved and empowered. They get involved in the patient decisions for their medical care. We involve them. They get spoken to every day. I think that the parents know that the goal that we have here is not to just treat them medically, but to create a family environment so that then when they go home, they feel they know their baby and they're comfortable with their baby. Our goal is always to give them a healthy, developmentally appropriate infant.
In the beginning, especially the first day or two, I didn't feel as connected because it happened so fast. It happened so sudden. He was 2.5 months early, so I was kind of in shock, I think, a little bit. I didn't know what to do or how to connect with him because he was in there, I was out here kind of thing. But after that, slowly coming here and doing the skin to skin, changing, being hands-on, being able to do normal things like moms do, change diapers, even though that's silly, but changing his diaper made me feel wow, this is my baby and I'm doing something, So those kinds of things made me feel closer to him and made me feel more like I'm his mom and he's mine and I'm, doing things for him. Slowly it's gotten easier, just being into a routine with him, holding him every day, talking to him about normal things that if I was home I'd talk to him about, But in the beginning it was hard talking to him because I didn't know if it was weird of what I was saying. Should I be talking to him like this? Can I tell him things that I'm scared about? But the more I did that, the more comfortable I felt and the more close I felt to him. I could talk to him about anything, kind of,
I mean, you guys were so helpful. You and Erica were just always checking in, advocating for us when she was still 2, just so that I could touch her and hold her, getting me to make connections with family that I never even thought of. Watching Owen when Jason did his first skin to skin so I could be here for those first couple of moments. But it's amazing what you guys do. Just being the support that I guess we never knew we needed, and then you guys are just right there every step of the way, so it's been amazing.
I actually got to bond with my baby in a very difficult situation. I think that every single mom and dad should have access to this kind of support.
We're so excited that the Valley Hospital is bringing family nurture care as the new standard of care to their NICU. It will benefit all of our families, babies, and staff. For more information about our program, please go to www.nurturescienceprogram.org or look in the staff directory and contact a nurture specialist in the NICU. We'd love to talk to you more about what we do.